Everyone. I am Kamal Narayan, CEO of Integrated Health and Wellbeing Council, India's premier institution for health awareness, advocacy, and behavior change. I welcome you all to this special live program where we would be trying to analyze the Union Budget 2021 through the prism of how much it's going to help us in making of a Swasth Bharat or Ayushman Bharat, a country where people live healthy, longer, and happier without the fear of diseases or the catastrophe they face while trying to get the health care needed to protect them from diseases. And this is something every individual, societies, and nations have learned the hard way during the ongoing COVID-19 pandemic. For last a few months now, health providers, experts, and enthusiasts like me have been advocating for correcting the historical wrong of allocating lesser for public health and not considering it a priority area, unlike defense or infrastructure. And why we all felt it was the high time for doing it, as we all have to undergo some experience of the same experience of fear, uncertainty, where being and staying healthy became more important than anything else, because we saw how the world, including the most developed nations, struggled to cope up with the raging virus. Though India could fare better in mitigating the human cost of the pandemic, it also brought forward its glaring gaps in health infrastructure and the system. And when Finance Minister Nirmala Sitharaman today rose to present the budget that tries to rebuild the nation like never before, she did echo the sentiments of healing the billion and making the health and well-being as the first pillars of the government's vision of creating an Atmanirbhar Bharat. And with this note, we would try to understand that how much this quest for making Atmanirbhar Bharat, which is also Ayushman Bharat at the same time, and a Swasth Bharat as well, is going to be materialized or going to be possible within the framework of the budget which was presented today. We have a galaxy of experts with us to talk on this, and we will be also joined with many other experts during this discussion in the next 1.5 hours, and would try to bring forward all that concerns to your health, and also to make you understand what is in it for your health in this budget. So let me introduce our experts today. We have Dr. Bobby John, who is a global health advocate and former consultant to WHO, and also the part of ISW Council's advisory board, as well as the co-founder of the council. We have Mr. Sanjeev Nawangul, CEO and MD of Bharat Serums and Vaccine Limited. He is going to represent the pharma industry, and from whom we will try to understand that how much it is going to help increasing the research, increasing the production, and making medicine to the reach of the people. We have Dr. Chandrakant Laharia, one of the very eminent name in the public health, and has been highlighting several aspects of this pandemic and how the India has been managing it. We will try to understand from him that how this budget is going to help in this post-COVID-19 scenario. We also have Anurag Kumar. He's a health economist and also a senior associate with Niti Aayog, the government's think tank for rebuilding and making the nation a stronger country. There is some disturbance at my end, so I will kind of excuse me for that. So let me begin. Let me begin with Dr. Chandrakant Laharia on this. Dr. Laharia, you said your book says till we win, and I think the battle has still not been won. How the budget 2021 is going to strengthen our fight against COVID-19. We have seen that a big, 35,000 crore has been allocated for the COVID-19 vaccine, but how much it is going to help us getting the final victory over COVID-19?
Thank you very much, Mr. Kamal Narayan, and thanks for inviting me. Also, I would like to mention that these are my personal opinion, and please do not attribute to WHO. When we wrote the book Till We Win, we have made one of the core argument that the pandemic will definitely be over, but that cannot be considered a victory point. The real victory against pandemic would be when we learn and then implement those lessons which we learned during the pandemic to strengthen India's healthcare system. So we will win when pandemic will be over. The lessons will be learned and implemented. So that's going to be a long journey. While we can have a pandemic over much before, but victory in the process will be long, a little later. Coming to this budget, we need to have some context. One, we know that this is a budget which has been presented after a once in a century pandemic. So there have been challenges. Also, this is a budget which has been presented after the report of 15th Finance Commission was submitted. We know that the contraction in GDP is around one of the biggest in the last 4 decades. So there is definitely limitation in the resources, and the fiscal deficit, which we are seeing, is around 7% fiscal deficit, which is one of the highest in many decades. So in that context, the budget has been presented. What we see from the numbers that one side, if we look at the health and wellness part, Honorable Finance Minister has announced that 137% increase over the previous year budget. However, if we look at the detailed analysis from the budget speech annexure, which is available on the budget speech, page number 37, which say that the Ministry of Health and Family Welfare, the Department of Health Research and Department of Health and Family Welfare, that budget has increased by 10% over the last year's budget estimates. So when we look at the other components, how this 137% increase, we know that the amount of 35,000 crore has been allocated for COVID-19 vaccination in India, which in itself is a good indication. I'm saying that this is good because this as per some of the estimates, experts had analyzed that the government would require something like 27,000 crore or so to vaccinate the target population which it has intended to vaccinate. So allocation of 35,000 crores gives an indication that there is definitely thinking going on that the government would provide or government would cover the cost of vaccination in the country, and the vaccine would be free for the people. That's what indication we can get from it. And definitely a good number of people can be vaccinated with this amount. And over and above, if states contribute, we can hope that the COVID-19 vaccination in the country for the people will be free. Government would be covering the cost. And that's itself a good sign. Other aspect on the wellness part, we see that much of the allocation is water and sanitation, which is an integral part of wellness, because if we can improve water supply and sanitary conditions, it can reduce a major burden of disease, diarrhea, and other aspects which cause a lot of hospitalization and deaths in the children. So if it's being counted together, I have no problem. It's a good sign. Other part of the budget is, and which are more of components in the budget. I think one of the thing which government should be given credit that it has recognized the importance of health, which we were already hearing, but it's always pleasant to hear from the finance minister and official government policy that we are giving highest importance to the health sector. So that's itself is a development. Then within health sector, deliberations and discussion and upfront mention about the need for health system spending and allocation of rupees 65,000, approximately 65,000 crore for a period of 6 years by the name of PM Atmanirbhar Swasth Bharat Yojana is also an important step. Right now, it's a 65,000 crore for 6 years, but once you have initiated a program, you can always expect and the money can always be increased. But within that, the concept of the preventive health the curative health and well-being putting together, talking about renewed attention on the health system strengthening, these are some of the good developments. Some of the things which we are hearing and which have categorically said, well, let me finish this part, and so in last 30 seconds. So
Yeah.
some of the things which we are hearing is that establishing public health laboratories and integrated public health labs, One Health, National Institute for One Health. These are the really good steps. Of course, as a citizen or as an individual or expert, we always want that allocation should be far higher. There were estimates people have made that if the national health policy target of 2.5% of GDP need to be achieved, the core health sector allocation for this year should have been around 120 to 130,000 crore. So in summary, uh, this is a good start. There are some of the good commitments. I see the free vaccination from the people's perspective and some new dialogues and discourses. Of course, no health expert ever say, or no public health expert say that government has allocated sufficient for health.
Thank you so much, Dr. Chandrakant. But also for highlighting that this allocation, especially on the vaccine, that definitely is going to help a long way in terms of winning our fight against COVID-19, and also for underlining that the allocation of healthcare system strengthening is going to be an important aspect. Sanjeev Navan ji. Market has been responding, like frenzy after the budget. We are seeing Sensex going high, and it is like everyone is in the welcoming mode. Industry is welcoming this budget. How do you see this budget?
Yeah, I think two parts. Number one is, I think, from overall industry point of view, probably there are a lot of encouraging signs here. I think the move to privatize businesses, as Margaret Thatcher always said, government has no business to be in business, is probably getting more understood, and this is a welcome sign. Even privatizing banks, ensuring quite a few stuff. So there is enough for the industry to say that, look, this budget is one step forward in many steps that are being taken, and these are really good steps that are happening. GST, the bankruptcy bill, now privatization of public sector banks. All this is very healthy. So from an overall industry point of view, I think very, very good for the health of the industry. Let me
Health of the nation.
yeah. But now let's come to the healthcare industry. I think what Chandrakant mentioned is important to understand, that basically the healthcare budget has not been increased. Core healthcare budget has not been increased substantially. It is what was happening every year. Like, for example, last year, if it was increased by 8,000 crore, the health and family welfare budget has been increased by 6,000 crore. I think health research has been increased by 500 crores. Ayush has been increased by some 800 crores. So it's in the same ballpark as earlier years. So let's not get carried away by that 137%. It is in fact slightly lesser than what they increased last year. So the overall healthcare spend of the government is only going up because of two reasons. One, vaccines, 35,000 crore. And probably what I would expect is that 35,000 crores remains as a block and gets continued to be spent every year in one or the other thing which is necessary for healthcare, and then it can be constituted as part of healthcare expenditure. Otherwise, it's a one-time expenditure that we need to see how. It's a great thing that they're doing. I think what it means is that we're going to cover senior citizens also. So a good chunk of population is going to be covered by vaccination, which is a great thing. I think we should applaud the government for doing it. But the healthcare budget is what it is. I think core healthcare budget has not been increased by much. What has been increased is the drinking water budget, the sanitation budget, which is also great. See, I think in your let's say headline as IHW, the W has been taken care of quite a bit. The H still is something that we need to keep thinking about. That how and where will we go in H. So the bigger point here is that the healthcare budget of the country on the core side should have been doubled this year. If I add 35,000 crores back and say, okay, this will continue as expenditure, then the budget has substantially increased, because then we would be increasing the budget by at least some 60-70%, which would be very, very useful in the long run. So let's understand that. The other things that they have done, which are small in nature but are very important, is the increase in starting a new scheme for infrastructure building in smaller places, hospitals and infrastructure, increasing number of labs for virology and infectious diseases. I think these are very, very important steps. What I see is the biggest plus is actually something else. If it means that philosophically, the first time probably since independence, if government is putting health primary in their budget, is happening for the first time, that health is being discussed in the budget as a primary story, then it's a great sign, because everything else under the sun used to be important for all the governments, but not health. First time we have seen health being center stage in the healthcare budget. Now, if they have added sanitation, drinking water to see the expanse of the budget numbers being high, fine, I'm okay with it. I don't want to crib over these things. I think preventive healthcare is equally important, and this government, I would say, has been very consistent for last few years on preventive health, saying sanitation, drinking water, these are things which they have been talking about, and they spend a lot of money, and this is a great thing. But always remember that for impact of preventive healthcare to happen, and Bobby is an expert, he will tell you it takes years and years for you to get preventive healthcare outcomes, while the necessary core healthcare needs to be increased substantially. One last point I want to mention is on, I think, the customs duty. There are a lot of customs duty notifications now about to come out, and many of the exemptions are getting removed by after 3 or 4 months or 5 months. Many of those could be pharma raw materials or pharma products. So that would actually mean companies going to NPPA and asking for an increase in price. So it could be slightly inflationary for patients if the custom duty exemptions are removed from many of the pharma products or raw materials, which is something to think for. That and I don't know the details. It's a very, very preliminary outlook, but that is something to wait for, because that could mean inflationary for patients.
Thank you, Sanjeev ji, and good that you are highlighting that the W of the integrated health and well-being has been very well taken care of by the government and finance minister, and also their focus, the consistent focus on prevention side has at least continued. Let me go to Dr. Bobby now. Bobby, how do you see this budget? You have been always advocating that health has an outcome of multiple factors, right from the water, food, air, and many other aspects. How do you see this budget making a substantial impact or difference on that?
Well, thank you, Kamal, and everyone else who's joined in for this discussion. Like you pointed out, I've always been a firm believer that health is not merely hospitals or doctors and nurses and medicines. It is many things working together. And in that sense, the clubbing of the numbers to arrive at this 137% increase is, in a way, a helpful way of thinking. The numbers may not stack up, and that is fine. We will come to it in a second. But recognizing that water, sanitation do play a very important and vital role in shaping the outcomes, especially in early childhood development and in reductions in man days lost due to ill health, is absolutely a good way to go. And so therefore, no questions asked. In the same breath, I would also point out that in a different part of the budget, the continuation and the expansion of the Ujala scheme is also helpful. A lot of the women-related domestic respiratory illnesses and related difficulties are also addressed by this continuing and expanding scheme that shifts household indoor pollution away from wood and fossil fuel-fired kitchens to cleaner sources of fuel. And so therefore, those are places where I see how health is from different directions coming together. What I also see is a very interesting thing, if it actually can be made to happen sooner than later, because this has been talked about several times over, that if vehicles, commercial and personal, can be taken off the roads sooner than later, 20 years and 15 years is what is right now being mentioned. If they can be actually accelerated, if there can be some stops for it, then it also contributes to a reduction in our PM2.5, PM1 levels in the and PM10 levels in the atmosphere. And that is something that also directly contributes to human health. And so therefore, from these contributory sides, I think there are helpful cues here. It's in the specifics within the domain of the Ministry of Health and Family Welfare and allied ministries, the WCD and rural development, where perhaps we may need to dig down to figure out whether the numbers all stack up or whether we needed to do much more. And the short answer for me, as I would echo Dr. Laharia, is that we need to do much more. Health, for the first time, at least in terms of the number of times the word health has been used in a budget speech, in the written form also, in also the order of precedence of the topics in which it's been taken, it finds itself much further up on the agenda than it has ever been before, and that is welcome. Translating that with much harder numbers, if I kind of take what Sanjeev Navangul said, if a one-time 35,000 crore COVID vaccine allocation actually becomes a regular part of the budget and continues to be maintained at those levels, then we can see the 1.8% of the expenditure being real. Otherwise, if we take those off, then perhaps we are not even getting to the levels at which we were expected to be by 2021. And that's something that I would mark as a point of caution, because while the commitment and the requirement is to go to 2.5 with a $5 trillion economy, with a proportion, with a relatively flat spend on health, you are not going to get to that 2.5% of the GDP spend that you want. Last thing, India health expenditure is not confined to the federal budget alone. India is a federal polity and health is a state subject. And so what matters will be also how every state also begins to pitch in. And this is where the acceptance of the Finance Commission's 41% allocation devolution down to the state is also helpful. States will have cash. Whether they actually are translating that into higher allocation for health will be 35 different budget documents to be looked at and understood in totality. And they may change and they may be widely variable. There may be larger states that may lag behind and pull down the overall proportion of expenditure on health at a federal level.
Thank you, Bobby. So symbolically, at least we can consider that the budget 2021 is definitely putting health on the priority order, and it is also trying to bring in multiple contributory factors which impact health in the short term or long term. Also try to make a substantial improvement towards that. Mr. Anurag Kumar, you have been highlighting in your writings that expenditure in health is not expenditure; it's an investment, which can bring a very high, social returns. How do you see this? And keeping in mind that Niti Aayog has officially been, kind of highlighted that there is a need for increasing the healthcare budget of our country. Dr. V.K. Paul went, on record saying that. Still, we see that the core sector of healthcare or the Ministry of Health and Family Welfare, as the others highlighted, have not got that much, addition in terms of their budget. How do you see that? Is it the budget which will have high social returns, or it is the budget which is going to be just another budget trying to focus more on other things which are of higher priority for employment, for economic rebuild, and multiple other aspects.
Thank you, Mr. Kamal. So first, thanks for having me. And just to say, these views reflect my own and not necessarily that of Niti Aayog. So I think the first point, and what's already been made, but I would just like to reiterate it, is that what this budget signals is definitely an increasing importance of health in the economic and fiscal apparatus of the country. And not just this budget where, health was the first of the 6 pillars symbolically, but also the Finance Commission report after a long time has an entire chapter on health financing. And the Economic Survey of India, which was released on Friday, has 2 chapters on health, one on health and one on Pradhan Mantri Jan Arogya Yojana. So these 3 things combined, make up a big part of the economic and fiscal apparatus and thinking. And so to that extent, it's very important. Now, coming back to, I think, look, there's been some real increase in the health expenditure, especially on account of the Finance Commission grants. So if you look at the breakdown of the health expenditure, around 13,000 crores for 2021-2022 were Finance Commission grants, which are earmarked for health. And so this also represents a real increase in expenditure, which will go towards the health sector and hopefully increase sort of the utilization of health budgets at the state level. So the first point is, look, the real increase might not have been that much, but there has been a real increase. And then there's also the spending on vaccines, which are a very classic example of a public good with large positive externalities, right? Something that the market will underprovide. So I think these 2 or 3 things combined will have a high will have a high economic return. So what I focus on and what you had mentioned was that health is not just a social sector expenditure. It is also an economic investment. It's an economic investment because it leads to more productive people, people taking less time off work, children learning better and growing up into more productive adults. It leads to a lot of more jobs and sustainable jobs being created, which is obviously another focus that we have. And third, it increases resilience of the economy to health shocks. So, providing a large outlay for vaccines, having Finance Commission grants exclusively for health, and then some increase in the health budget itself, and then on the other determinants of health, such as water and sanitation, will definitely have these social and economic returns, not just in the immediate term, but much more also in the future term. In the immediate term, they'll obviously come with more opening up of the economy as more people get vaccinated, and so the friction to doing business decreases. So in my view, yes, it will have a good economic and social impact, the health budget, but it might take a few years to come.
So you are of opinion that, if we consider the Finance Commission portion also, there is a substantial increase in the budget of core health sector. Dr. Laharia, we have seen a first time or one time expenditure, as Sanjeevji highlighted, that on vaccines, which may continue in the future, with some other kind of immediate needs related to healthcare. But is it also, going to be a scenario where, in general cases, we kind of try to respond to healthcare crisis with one-time expenditure in our family, in our, normal life, and once it is gone, or we, are healthy again, or we have already taken care of the health problem we are facing, we, kind of again divert our attention from health to other aspects of life. Is it going to be this kind of scenario also, or there is a possibility that this 35,000 crore, if it is included in the health spending, it is looking that we are going to have a substantial, higher amount being spent for health? But is it also possible that once it is, out of the question or out of the picture, we again come back to the, the same conventional way of lesser or meager spending on health?
So let's understand one more aspect. One is that in this period, in this budget, the 10% increase in allocation is far bigger, especially when the GDP has contracted by around 8%. So the effective 10% increase is far bigger than the 10% increase in all previous budgets, where the GDP growth was 7, 8, or 10%, which is actually in that sense, in the comparison of those budgets, was hardly an increase when GDP is growing at 10%. But when GDP is declining, 10% increase essentially means around 17, 18% increase in some sense. So it's a good move, and we should give credit there. Then coming to the vaccines part, of course, the vaccines are required, and there is an ongoing debate in the country that government should be providing. Not debate, many experts argue that, and even in this panel, that vaccines are public good, and when public goods are offered by the government funding, it's always helpful. So that's a very welcome step. The key challenge is, and key missed opportunity, if I can say so, is that this is a budget which has been presented in circumstances where everybody has been talking about health, increased need for investing in health and health system standing. And if with that kind of attention, the allocation which is as part of the core budget, health sector budget, is increased only marginally, and that is something with disappointment, that if with this much of attention, the allocation is only marginal increase in the routine budget, then if once pandemic would be over and when there would be less attention on health, we cannot expect the similar kind of increase in allocation. And keeping the vaccine budget aside is itself is the reason that it's not part of the core budget, and there is no reason to believe that it would be sustained. Of course, if government decides, and as it happens, I wish that's not true, that countries in the pandemic next year also, that there would be need for a more allocation for vaccines. But I foresee that the approach to delivery of vaccines when the world is in the pandemic would be very different than the approach to deliver the vaccine when pandemic would be over, and then probably the responsibility to get vaccinated could be shifted to individual. So yeah, to summarize these points, it was an historical opportunity where dialogue was on health. That's why we expected a far higher increase in the core budget. Vaccines, of course, is good investment. Linking health, wellness, and curative care, and discussing about health system standing is a good start. So it's a mixed bag.
It's a mixed bag. That's how you are looking at. But thank you so much for highlighting this point also. That when we, it's like looking the glass half full. That despite the economy contracting, to a very high percentage, still we are, if adding budget or allocating higher for health, even if it is 10%, it makes a very, very important statement from the government that the health is coming on the priority, on their priority. Sanjeev ji, you are hopeful that this 35,000 crore is going to be sustained and utilized maybe in the future for many other kind of vaccination programs or other important interventions which may be the need of the time. However, Dr. Laharia has a different opinion on that. But apart from the system strengthening and then the multiple other areas being taken care of, there were also some important demands coming from the industry, and especially, for example, GST on certain critical medicines or life-saving medicines, or something which is let's say for as critical as cancer. How do you see there? Could the government have done something more for them, keeping in mind that the pandemic has also kind of increased or added to the burden of many other diseases because of the disruption in the healthcare and other aspects. So should these segments also have got better support or better helping hand from the government?
I think, Kamal, with the backdrop of the budget and the contraction of the economy, I think there were constraints. So one can understand constraints, and therefore it is about pick and choose what you want to do. And that's why I'm more hopeful about that government should think of continuing this 35,000 crore expenditure year after year, which is on vaccines today, but could go on something else tomorrow. That's probably my biggest submission if I have to come out of this. It's important that this is not seen as a one-time expense by anyone, including the government. I'll give you, I will, let me cry my regular cry, that I say that this country spends 4 lakh crores on defense and 65,000, 70,000 crores on core health. We are the only country amongst the top 50 countries or top 50 economies of the world which has this trend of spending less on health compared to defense. And every country has their defense priorities. So we have no excuse to say that we will spend less on health compared to defense. Let you spend even 10 lakh crore on defense, but don't spend even 1 rupee less on health compared to defense. Because citizens' health defense is also equally important. And that is something that, if this was the year where we could not make that at the forefront of discussion, then when will we make it? On the other point that you mentioned, Kamal, is the fact that I think one important demand that the industry had, which should have been fulfilled according to me, which to me probably, knowing the circumstances, I'm not so, I'm okay what the government did, but I'm only place where I'm really critical of the government today is the fact that why is India looking good right now in the global world in COVID? It's because of the entrepreneurship of the industry with no help from anybody, build vaccine capability, build research capability, and I have been able to deliver a couple of vaccines immediately and more will come. Yeah, with nobody's help. Let nobody claim that I helped, you helped. The industry by itself did this. Yeah. So if that is the strength of this industry and therefore this industry is proving that it is world class, R&D expenditure deduction, which was demolished by the current government, should have been brought to at least 300%. To give that thinking back to the industry that you people are doing really a great job making India look good in the world in R&D. And if R&D deduction, we as a government, this government did not consider it important and dramatically reduced it. We understand now the need of this and therefore we bring it back on the table and make it even better and make it 300%. That would have been a headline statement, would have costed the government very little money, but would have really sent a signal that the scientists of this country who have made India look good are respected, and this would have been the best tribute that the government would have paid to the scientists, which I find it missing. Great opportunity missed. I think if I would have been in the government, I would never have missed this opportunity.
That's an important statement. That this is a one missed opportunity. Is that mean, Sanjeev ji, that in the quest of making Atmanirbhar Bharat, we have not been able to give enough opportunity for pharma industry or research to become Atmanirbhar?
Absolutely. I think we understood the mistake we did in 1995 DPCO, and we continued the DPCO mistake years after because of the API industry getting demolished in the country. I think having understood the national security risk that China is posing now to us on APIs, we started PLI schemes. But that's a small part. The bigger part for India is to go up the value chain, become an innovation country, for us to be world players. And for that, R&D has to be focused. And R&D within private sector industry has to be focused. For that, this was the best chance ever missed.
Dr. Bobby, how do you look that missed opportunity? Keeping in mind that while you promote that public health expenditure contributory factors are very important and they are kind of being taken care of in this budget or overall government policy, but at the same time also being a doctor, believing on science, have we missed out this major opportunity of making or converting India into a research and development hub, which might have directly helped in the whole vision of making India Atmanirbhar?
Absolutely. Sanjeev picks on a very vital point, and this is where we lag behind. If we look at our per capita output of research vis-a-vis other countries, we lag far behind, both in the basic and then even more dramatically in the translation of basic to viable products in the pipeline. And it would have been fairly simple, no cost innovation from a finance ministerial perspective to be giving a fillip to research, and especially translational research, which would have allowed for Indian companies to move forward with their pipelines or with newer products in place. I would probably push one step further along from where Sanjeev said, and it would have been to look at also startups or early stage startups. I know that there's been a relaxation in the caps and in the requirements that are there for such companies and their compliances, but these are the ones that really take existential risks as companies in moving forward with early stage product development and allowing them to be supported, especially by partner companies in their translation, would again have been an expansion of it. And that's again a missed opportunity. That said, I want to kind of highlight a couple of places where it's in the smaller, finer print, where I think we may begin to see some very interesting things. We are all being taken up by the 35,000 crore vaccine allocation, and it looks like it's entirely COVID. But in the paragraph that the minister was reading and in the speech, it's a very quiet statement that we are going to expand our pneumococcal vaccine coverage from 5 states to the entire country. This to me is the continuation of the expansion of vaccine coverages for vaccine preventable diseases among the childhood age group. The estimated number of lives to be saved by the expansion of this vaccine coverage is about 50,000 per annum. If we see the trajectory we have added in the recent past and scaled up dramatically over the last 3 years, the coverage on rotavirus. Now we're adding on pneumococcal vaccine. That too, both of these vaccines have been made in India products. That is substantial support for local industry and local procurement, and that is also substantially moving the needle on reducing under 5 mortality. That is laudable, and we should see the benefits of this in the 2031 census cycle, where we will see our life expectancy at birth actually change. We will see it earlier, but the dramatic number would be probably in the next decade or so. And so therefore, that's something that I wanted to point out, that's steady progress. That is in the plus side. On the minus side is the folding of the nutrition programs and making them into an omnibus mission 2.0, which inexplicably doesn't correspond to the reinvigorating human capital aspiration that is there somewhere else. Your school-going children or the output of your schools is only as good as the input that goes in. And in that sense, if children still go undernourished or they don't have adequate coverage, we may actually be doing a zero-sum game, investing in something that is downstream to what you should have invested earlier on. I don't see the exact configuration or reconfiguration of the 112 aspirational districts. Probably they remain the same. Probably the number seems to be looking a little bit on the downward side. That is not a step in the right direction. And that is something that we need to figure ways of correcting. Because if our aspiration is to reduce under 5 mortality, which we're doing by increasing vaccine coverage, we should boost it up with a better coverage on nutrition rather than have it static or even go backwards. Together, they will then allow for a 5-year-old child who's now appropriate height for age and appropriate weight for height, get into school with proper cognitive capabilities and be able to get through in a way that begins to build up our human capital. And so therefore, that jointedness of thinking from the health and from the human capital side seems to be a little bit missing. And that's something that I think is a missed opportunity. And so therefore, would want to see a little bit of a thought process. Last bit, that 35,000 crores, whatever subset of it is going to be only COVID, is there something that is there for pneumococcal vaccines? And if the COVID scenario moves to something that is a once in 2 year vaccination program, if that may be the case, too early to kind of talk about it right now, then we might probably see the retention of this in the budget as a feature. If it is not, then that's a substantial increase in out-of-pocket expenditure that may be shifted into private hands, and that may not be a good idea.
Yeah, Kamal, just one point on what Bobby said is on pneumococcal vaccines. I think it's a very important point. It's a great initiative by this government. I think to expand it further, I think the Indradhanush scheme is getting expanded. And my submission always would be that once this 35,000 crores is done away for COVID vaccines, let's also move that money partly into adult vaccination. Because there are also issues on adult vaccination that we need to take care over a period of time. Because your life expectancy comes in parts and you need to cover many things at different times of time. The comorbidity risk in India is clearly understood with the deaths that we saw in COVID. So above 50 adult vaccination should become another journey for us. And therefore I want continuation of the 35,000 crores. And there are other areas which we have never brought into play and we should continue to do that. But Bobby, great point on pneumococcal vaccine.
Maybe the vaccine for cervical cancer become the another one area where they need to take up. As we are reaching towards World Cancer Day, this is one burden which is we need to reduce substantially.
Flu vaccine, zoster vaccine, there are many other things that we need to take because at certain point of time, certain comorbidities increase risk and we will need to do a few things.
And this is where, sorry to kind of jump in, but this is where we need to kind of begin thinking through our doctrine of what is prevention. There is the notion of health and wellness centers. I see the number that is there. I also see that this is probably a subset of the number that was earlier thought through for the expansion under the National Health Assurance and National Health and Wellness Centers, the 150,000 odd centers that were there. Is this a subset? Is this additional to it? Need to be clarified. But having said that, do we need to continue to expand Indradhanush to cover the full range of possible antigens in the childhood vaccine space? Yes. With COVID, and as you mentioned about cervical cancer, and with several others, flu and zoster, are we also needing to look at an adult vaccine coverage thought process? And if so, the burden out of pocket versus the cost-benefit ratio of it being provisioned through the public health system needs to be thought through and placed and be absorbed into the public health finance system. And that would probably then reduce significantly both the morbidity, mortality numbers that we may have associated with these disease entities, and also reduce the out-of-pocket expenditures that otherwise people might incur. And so therefore, we need a lot more clarity there. One thing that has not been mentioned, and I want to kind of focus on that also, what COVID has pointed out, and this seems to be a response here, which is that we will get integrated public health labs. What we have faltered so far is on picking up signals early and clearly in this country when it comes to disease outbreaks. With the commitment to getting these labs in every district, and also hospital blocks for emergency response in at least 600 of those districts, we are beginning to significantly respond to the challenge that COVID placed on us. This, to me, is a very, very helpful response and only goes to point the direction in which we need to move forward. We cannot depend on our tertiary care hospitals. We cannot depend on AIIMS-like institutions. We have to devolve down to the districts, and we need to have also the BSL-3 labs and the NIV-like structures at regional levels, which will allow for better and faster responses. Those are all very, very useful interventions or additions into the health sector that at this point in time have been deficient.
Thank you, Bobby, for highlighting these important aspects. Let me go to Anurag. Anurag, 150,000 health and wellness centers were supposed to come up by year 2022. We are already, kind of at the beginning of 21, and this budget also talks about creating, around 17 plus 11,000 of them on both, urban as well as rural areas. what is the situation as of now? What is your opinion on this? How much it has already been there, and is it really a new addition, or we are talking about the same number which we had already been kind of highlighting or aiming for?
Sure. So just in terms of the background, around 50,000 of the 150,000 health and wellness centers, which were announced in 2018, are functional. Obviously, this year there was supposed to be a big push, but due to COVID, the rate at which the functionalization of HWCs could expand was limited. And so going forward, we can expect that we reach that target fairly quickly of 150,000. Now, the details will have to come out on what these 28,000 are, but my sense would be that it's further strengthening the services and the infrastructure in these health and wellness centers. And towards that, and I think the Pradhan Mantri Atmanirbhar Swasth Bharat Yojana does two very good things in strengthening the core public health functions, right? It strengthens the core public health functions across the different levels of care: promotion, preventive, and curative. The functions of care, and across the different levels of care. And so having a greater focus on primary health through supporting 17,000 rural HWCs and 11,000 urban HWCs will also increase the public utilization of healthcare, which, we've been saying that even for primary care, currently almost 70% of the people go to the private sector. So pumping in more money into primary healthcare and strengthening the health and wellness centers will correct that, which will also reduce out-of-pocket expenditure, which mostly again happens for primary care, for outpatient care. And so that, I think, is an important step in the evolution of health and wellness centers. Relatedly, and this is a little bit separate from the health and wellness center points, but related to the Pradhan Mantri Atmanirbhar Swasth Bharat Yojana, is the focus on surveillance and preparedness, things which public health experts have been saying that we really lack in. And so anything which strengthens the NCDC, develops public health labs, expands our integrated health information platform to all the different states, expands and strengthens public health units, is extremely important. It sort of builds builds the core public health capacities, which is the function of the government to do. The market doesn't provide that. There's large positive externalities, and it builds a lot more capacity, strengthens our existing institution, creates new ones, and hopefully the health and wellness center focus on this means that the public utilization of healthcare, or the utilization of healthcare provided by the public sector, will increase. It will reduce out-of-pocket expenditure and have better preventive and promotive health.
Thank you, Anurag, for highlighting this. And so what we can think that, or what we should take away from here, is that these 28,000 health and wellness centers are the existing 50,000 centers which have been put up under this 1.5 lakh HWC centers, target. And this is to strengthen their services, not to add more into that number.
Again, I think we should wait for the health ministry and for the clarification documents to find out the exact mix, whether there's some amount of increase and some amount of strengthening services. But there will definitely be some component of strengthening services and some component of potential increase. So I would wait for more details is my short.
I'll go to, we have, been joined by Dr. Sanjeev Kumar also, a very eminent public health expert. He has also been working with WHO and has been advising as, WHO, as well as he's also part of the governing board of National Institute for Health and Family Planning. So I'll come to Sanjeev Kumarji, but before I'll go to Sanjeev Nawangul again, he has to leave at 4:30. So, just to get his, the parting remark before he, locks off. So Sanjeev ji, you highlighted that there are certain, missed opportunities. You are also hopeful, and that these 35,000 crore, which is allocated for vaccine, is going to be utilized for many other, vaccine program. If and that will be a welcome move if it happens. Overall, how do you see the budget from the health point of view? And if you were to mark it, how will you mark it with 1 to 5 scale in terms of what all it could have done when it comes to improving or prioritizing health over many other aspects.
Hey, Kamal, I think this barking is not necessary because everybody has a judgment on it. I will say two, three things which I like. One is I think the overall understanding that health is prevention plus what we currently understand as health. I think that all put together as one block is a very important statement. If it is philosophical in nature for this government, I'm very happy that this thinking is good for the country. I think that allocation of money can be done in serious conditions like pandemic or any other health eruption is an important message to the countrymen that the country will be supported and citizens will be supported in case of pandemics and such situations, and allocating 35,000 crores for COVID vaccination. Another big statement, philosophically very, very important to make. The third part is health as such, making primary center of the budget. Probably first time in that has happened in our country. Actually, health was never a consideration for any government at any point of time. I think first time we have seen health become a consideration, real consideration. I think that's an important shift. And I'm always very passionate about health. So I really, my standards to be met are very high. So until now, it has not been met by any government. So that was my issue, that I think I like the current thinking around the health philosophy. If this is coming through this budget. The one important reform which people miss out is because we consider insurance only from a commercial aspect of insurance. But raising FDI from 49 to 74% also include health insurance. And this is probably the most significant health reform besides providing money for COVID in this budget, which we should not miss. For that, I will give very high marks to this government, because impetus to healthcare insurance is going to go up dramatically because of the understanding and awareness of pandemic. And in that background, if FDI in insurance has been hiked in a courageous way from 49% to 74%, this will have good positive impact on the marketing of healthcare insurance and penetration of healthcare insurance in this country. So if I were to market this budget, I would market on this reform, and I'll market on the fact that this is the first time a government is looking at healthcare as in totality, and it's a great move that even in pandemics, citizens will be supported. These are the three things I would market for this government.
Thank you so much, Sanjeevji. Quite an optimistic response from your side, and definitely this is an important critical budget for the health of our nation, and this is very well has highlighted and prioritized health according to that expectation which the nation has. And I'm sure there are multiple other areas which are need to be further worked on, and that the government will try to move on that direction in the next coming years. So thank you so much for joining, Sanjeevji.
Thank you so much
for this program.
Sorry to leave early. I have to join another TV channel, so I'm leaving early. But
no problem. Thank you so much for your time. So let me go to now Sanjeev Kumarji. Like in life, health is undercurrent and it's part of every aspect. This seems what Sanjeev Nawangul has highlighted, which we were not considering as part of our whole discussion on health budget of the country. That is the insurance part. That even if increasing the FDI on insurance sector is going to have a major impact on the insurance coverage for healthcare as well. Sanjeev ji, how do you see this budget, keeping in mind the multiple elements, contributory factors from drinkable water to clean air to health and wellness centers to integrated labs? There are so many things to talk about. How it is going to help us become a real Ayushman Swasth Bharat?
Thank you, Kamal, and my apologies. I was looking after my own health and taking a walk when the message came to join this panel. So my apologies for being late. In the morning and subsequently a TV channel talk by Dr. Harshvardhan. This is unprecedented, never before increase in health budget. So all of us working in health sector are very happy. And 4 things which have happened which make me very happy, based on the COVID experience. One is bringing all the laboratories together in public and private sector, the health portal which has been created. I hope tomorrow we bring all healthcare providers together at one portal so that you have all the data available under national digital health, which has been done. And going down to block level, at that level, 3,382 block level public health units, and integrating all of them into one, and then strengthening the National Institute of Virology like lab being established all over the country. 9 DSL 3-level lab being, that's one area where you can pick up infections, new diseases promptly and control them promptly. That's one area. Second is critical care has been strengthened. 602 district hospital will have a critical care unit which will be established. They have something, but it will be strengthened. 12 central level institutions, each one of them will have augmented critical care unit. So critical care is being augmented not just for COVID, but also for trauma, injuries, and many other things you have which are on the rise. You also have non-communicable diseases, heart attacks, etc. on the rise, and they will all come together in addressing. And at metro level also they have strengthened by establishing 12 surveillance units and related areas. One area we have been missing till now, diseases like COVID come to humans from animals. So one institute, National Institute on One Health, the decision to establish that has been taken, and now we will be able to work with veterinarians and others who are able to pick up infection in animals early and then take action. Unfortunately, the outbreak of COVID took place in China. 1 year for a WHO team to go there and investigate on the origin. So that those dimensions you will be able to pick up when you have initiatives like One Health, and at international fora, India's credibility has increased substantially in health. We should be able to put pressure on international organizations like WHO that they should make every country where outbreak of these diseases take place accountable for not reporting early. Taiwan reported in December itself there is a disease outbreak in China which is spreading from human to human, but WHO did not take action because Taiwan is not a member state. So, leave aside all these political issues and work on picking up these infections early so that we can protect rest of the world from these outbreaks. Allocation for vaccine also has strengthened preventive care. But 2 or 3 areas of concern I have, there is lack of trust in public health system. We saw it during COVID. The beds in public hospitals were lying vacant, whereas private hospitals were full. To my surprise, even healthcare providers turn out to get vaccination was better in private hospitals than public hospitals. If healthcare providers don't have faith in intervention, their own vaccination you can level. You may open health and wellness centers, but if the public doesn't have trust, they don't come to this institution. I don't see anything in the budget for building public health trust. I know one budget cannot increase public health trust. It has to be over a period of time. That's other area I have reservation is allocation is one thing. Utilization is another thing. I have been part of the government system. I have seen money allocated in the budget, revised in the budget estimates downwards, and then utilization is even below that. So there has to be a serious effort to look at the absorption capacity of the public health system, why they are not able to use the money which is allocated to them. And I feel the people who are responsible for this is the bureaucracy in India. They should be made accountable for addressing this issue. So this is my immediate response to the budget. But overall, I am very happy. Never before so much of money was allocated, and it was the first pillar of the 6 pillars in the budget presentation today. The whole budget presentation started with health. Never before. For the first time, I think this attention needs to be sustained so that we can have substantial improvement in healthcare in the country. Thank you.
Thank you so much, Dr. Sanjeev. And as important aspects you have highlighted, and especially the setting up of the new institutions and also critical care capability enhancement under the new Pradhan Mantri Atmanirbhar Swasth Bharat scheme. Let me go to Dr. Chandrakant Laharia now. Dr. Chandrakant Laharia, Dr. Sanjeev has raised an important question also about the efficacy of the government system, the trust towards it, and also the utilization of the fund. Many times the fund is being allocated but is not getting utilized. How do you see that will be overcome in the coming future, and what all can be done, or where the government could have done something additional in terms of enhancing the trust by ensuring that we have, let's say, for example, some model health and wellness centers, where people can actually see that what kind of care and services can be received from a government setup also. What is your opinion on it?
Yeah, so Dr. Sanjeev Kumar has a wide experience and of course highlighted some of the really important points. So how the trust of the people can be returned back, or how government health services can retain the trust of the people. There are many approaches to do so. And one of the key is that assured provision of services. What happens, there are many other different studies, and one of the studies WHO also initiated, and where we looked at the models of primary healthcare in 16 different settings and 12 different models, and we found that whenever there is an assured provision of services, which means whatever is service provision is assured through that facility, when people visit that facility, when they get that services, then people are more likely to stay adhering to that facility or returning to that facility. But that's not the only one. When we are looking for the services, we know that a particular facility need to cater to a health needs of different group of population. The healthcare provider should be available in timely manner. People should be respected. So all of this will come with over a period of time. The first thing is making these facilities functional, ensuring that services which are being provided are available in an assured manner. Also ensuring that the free medicines, the medicines and diagnostics are also available, because those are the major costs. So much of this is widely known, and this has been followed. So each of these initiatives, what we are calling public health or health system spending, would contribute to that process, that services are assured, wide range of services are available, when there is sufficient funding allocation, there are medicines, diagnostic provider, all of those are there. So this would be a process. At the same time, one of the key development I see in this budget is Pradhan Mantri Atmanirbhar Swasth Bharat Yojana, that there is a renewed attention on urban primary healthcare services. So I've seen the earlier version of this program, which will be launched, and as we were discussing in the previous section of this conversation, that some of the facilities, like we know that by 20th November 2020, India had 50,000 health and wellness centers, and now the number should be much higher. But as part of this program, the attention would be on setting up additional facilities and health and wellness centers in urban area, because currently the number of urban health and wellness centers in urban area is around 5,000. It aims for 11,000, and there is a provision for setting up more urban health and wellness centers in slums, and especially starting from the metropolitan cities, corporation areas, state capitals. So that's where the attention would be. So there would be new facility. So strengthening the primary healthcare services, especially in urban area, would also help in increasing the trust of the people. Similarly, strengthening the public health services in urban area would also help in this direction. What we know today that while rural setup has a wide network of primary healthcare facilities and deliver public health services, urban setting is mainly focused on treatment or curative services. Urban areas have it's a 1/3 of the country's population, urban setting, which is half of the rural population. But the number of urban healthcare facilities in India, urban primary healthcare facilities in India is, let's say, 1/5 of the total what we have in rural area. Rural facilities deliver preventive promotive care and public health services, barely any curative services. Urban facilities have a large hospital curative services, but public health services are largely missing. The primary healthcare is largely missing. So developing a right blend of primary healthcare, extending primary healthcare and public health services in urban area, then linking them with the treatment services. Also, it will increase access of the people toward these facilities will work. So it's going to be a slow process. I guess bringing different components together will contribute in this direction.
Yeah, thank you so much, Dr. Laharia. Mr. Anurag, Niti Ayog's intervention in one of the major development which we saw in health 2 years back, the launch of Ayushman Bharat scheme, and that has been substantially contributed and supported by the private sector. And it I think is one scheme where we have seen in the healthcare where the private players are kind of working shoulder to shoulder with the government and are helping government provide that critical care, that secondary tertiary care to the people who are in the need of that. And in the processes, quality care is being kind of delivered. The question which Dr. Sanjeev has raised, that in terms of trust and kind of utilization, efficacy of, say, government run institutions or centers. Do you think that there could have been, or the government should have taken some kind of a PPP model for health and wellness centers also, with some kind of financial incentives for the healthcare provider to set up in the rural as well as urban areas, where a minimum quality is assured, as in Ayushman Bharat, and they are kind of paid for or reimbursed for the services provided for the public?
Right. So I think, yes, first Ayushman Bharat made the switch towards demand side financing, right? Because initially it was all about supply side financing from the government, and Ayushman Bharat, amongst other things, bringing in the private sector, financing the patient and letting them choose where they want to go to. That was the important step. Now it remains to be seen whether, one, it's more difficult to do that in the primary care setting, because what you're measuring, the kind of procedures you have, the capitation mechanism where you give a private provider, an X amount of fees and then measure outcomes, is a little bit more difficult. And so let's, I think, first see how Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, PMJY, pans out in the next 3 to 5 years, because it's still in its scale up phase in a sense. It's not easy to give entitlements to 50 crore people, then ensure that they're identified, they know about their entitlements, they're aware of them, then to ensure that there is enough supply in the public and private sector so that they can actually use their entitlements. And I think once the learnings from there come, and also once all the HWCs with their expanded focus are operationalized, then let's see what's the need which is remaining. Because I think one other point which often gets missed, and I'd like to highlight, is though obviously a lot of people seek care in the private sector, the share of the public sector has been increasing over time in both IPD and OPD care. And I think some of the things which in the Pradhan Mantri, again, Atmanirbhar Swasthya Bharat Yojana, might serve to do that with the strengthened health and wellness care network. So let's see that this is something which is probably prudent to not do now, but wait, see how ABPMJ spans out, see how the contracting with the private sector and strategic purchasing, that the capability that the government develops over time, how that can then be used for delivering primary care, and also parallelly see the impact of HWCs in the next 3-4 years.
One more question, Anurag, which we have been discussing in this program, but since Dr. Sanjeev, kind of re-highlighted that, that how unprecedented this budget has been in terms of strengthening the overall health system, or, putting health on the priority. But again, which Sanjeev Navangulo has also been highlighting. And Dr. Chandrakant Laharia has very aptly highlighted that this was the most historic moment,
right,
of changing the whole, the way we deal with health. Something so essential for the life, something we can't do anything, and we have seen in the pandemic that everything else takes a backseat,
right,
when it comes to health. And this was the biggest moment. And as in any, as I have been telling earlier also, that like in life and in family, we have all our priorities of buying a car, buying a, house, buying a new apparels, going for vacations, doing all that possible, getting everything which we can kind of buy. But when it comes to a health crisis, or when you are not healthy, everything takes a backseat, and then you want to focus on health and you start thinking about health. And the moment when you are back to the good health, you forget about health. The worry is that if we had not been able to make that difference, or that track change in this year, how it is going to remain in the focus in the years to come can be something where we questions can be raised. What is your frank opinion? Has the government really been able to capture this watershed kind of moment to make something which is of social return, of higher economic return, higher defense return, in terms of stronger people will definitely be creating a stronger country, which you can't compromise the defense of that. So do you think that we have not been able to capture that moment, or we have captured it slightly and left it for the years to come?
Right. No, I think that's a very pertinent question. So I think one of the things is the fiscal space at any point of time, right? So anyone who is a public health expert on that and would like to say the union government alone should spend lakhs of crores on health. But at the same time, there's these fiscal constraints. And while this was a health shock, it also led to a lot of other economic shocks, right? It also led to a lot of disturbances in education. It also led to a lot of impacts on livelihoods.
Anurag, sorry, that is the whole point, because
right.
The health shock brings the economic shock. That is what happens to our, the people of our country. So many millions get pushed to the poverty, because the moment they get the health shock, there is also an accompanying economic shock, which, makes them poorer. So that is.
But I think there's multiple kinds of shocks. And while this highlighted the health shock component, there's also kinds of other shocks. And so my point there wasn't to say, that we should have done more or less, was to say, there was, relative to previous years, and definitely in terms of the total as a share of our GDP and the total amount of budgetary resources available, the spending on health has increased. And even more than that, I think 2-3 things which I think are more important than the absolute budgetary amount were the things I highlighted in my opening remarks as well, that even prior to the pandemic, the Finance Commission for the first time had an entire chapter on health financing. This year's economic survey has a chapter on health and on PMJY. And the reason I'm mentioning these again and again is, and as other panelists have said, that health normally isn't a part of the discussions in the economic and fiscal apparatus of the country. Now to have these publications, which are kind of centerpiece, the Finance Commission for Devolution to States and the Economic Survey for General Economic Policy Thinking, and then obviously the budget starting out with health, signals that there is greater realization of the impact of health, not just as, a social investment, but also an economic investment. So I think that's very important in terms of how we have captured this moment. And also thinking about the preventive aspects of it in terms of the focus on water and sanitation, and especially the urban focus, because previously we were focusing on the rural areas, but also recognizing, that a lot of these diseases can originate in urban areas. And then the budget for that has increased from, I think, 21,000 crores to 96,000 crores if you include the Finance Commission grant. So I think both of these things combined show that, the moment to some extent has been captured within the constraints of the fiscal space. And then the third point, again, which I mentioned earlier, but I think the Finance Commission also giving grants specifically to health is important, because you could argue that there is always before.
Yeah, Anurag, we lost your sound in between.
Sorry, so I think my last point was just to say,
the Finance Commission allocating specifically for health itself is a big thing.
So I think that's also a big devolution reform, because normally there's general grants which happen. There's grants from the central government, but then saying that these are grants earmarked to health. And as the Finance Commission final report is tabled, we'll see what the mechanism is. Perhaps these are output-linked grants. Perhaps these are performance-based grants. They definitely should probably be based on the need of different states. We'll see what those mechanisms are. But I think to that extent, within the constraints of fiscal space, the moment has been captured well. And hopefully this will become a regular feature going forward.
Thank you so much, Anurag, for these important points. Dr. Sanjeev Kumar, you are still with us?
Yeah, I am here.
So, Dr. Sanjeev, since we heard quite a welcoming response from your side, and obviously it's a very welcome move, and every healthcare provider, enthusiast, health thinkers are welcoming this budget. But Dr. Sanjeev, do you also feel that there has been some major misses in terms of this budget, and especially if we keep in mind and what other panelists also highlighted that especially we look into the R&D segment of it, R&D part of it. What we are being proud of as of now is the rapidity with which we have been able to bring out the COVID-19 vaccine, which is not only promising to support our country, but also we are going to support to as per the government statements around 100 other countries also. And we are becoming a big bright spot for the whole world in terms of how we are leading the overall health interventions, and especially during COVID-19. Shouldn't we have done better, or at least kind of brought back our budgetary allocations for higher R&D in the space of healthcare and pharma and medical research?
So you raised a very important point, Kamal. Whereas we are, celebrating this increase in allocation, we need to look at some of the components. India is also a leader in technology, but we have many technologies which have been used in India. For example, Tripura has a program called Teleophthalmology program, which started in, if I remember correctly, 2008. It was scaled up to the whole of the state. It is a small state in 2015. So they have limited number of ophthalmologists only in one city, Agartala, in the 2 medical colleges. But 95% of people with eye problems are seen by the specialists in these medical colleges. Why this has not been scaled up whole country? So you have many other intervention where technology can come to rescue, and that's an area of concern. Then doing new research, and what we are missing is research in health system strengthening. We are seeing, I started practicing as an intern in 1975. We are seeing gradual shift of the patient from public hospital to private hospital. And it has accelerated in recent times. Nobody is looking at operational research. So that's one area in research and development. Then the other area which is missing in research and development is behavioral aspects. And I am a co-member of the core team which is looking at health research policy, which is being written by Department of Health Research under chairmanship of Dr. Vinod Paul. very little research is done on behavioral aspect. We are into non-communicable diseases, which kill about 2/3 of Indians who die in India. We have to look at behavior. One is they need to pick up the disease early. That's true even for diseases like COVID. They need to report, and that's a behavioral aspect. They need to come to an appropriate level healthcare provider for diagnosis and treatment. Non-communicable diseases are more or less lifelong treatment or a very long treatment. Taking treatment as advised by the doctor is again a behavioral issue. So very little work on behavioral issue, but I'm sure the Department of Health Research, which is a sister department of Ministry of Health and Family Welfare, will be looking into some of these areas. Second thing we are missing is research into health system. Where is most health and wellness centers were established, a great achievement, a great initiative. But you can't look at only one level. You have to link the whole healthcare providing system to that, including private sector. 60 to 70% people in rural areas go to private sector for healthcare. 70 to 80% in urban areas go to private sector. We need to bring the private sector into mainstream, and we need research, operational research, how to bring in the private sector so that we have comprehensive healthcare provided to the people. The third aspect, I would say, we looked at doctors. Till last budget, we were looking at so many medical colleges established, so many established resources comprehensively. In this budget, we heard about strengthening nursing care by establishing a body to look after. But we need to look at whole human resources for healthcare together. Healthcare is a team work, not a doctor's work, not a nurse's work. Yes, they are an important part of the team, but you need to look at the whole. I didn't see any movement towards looking at integrated human resources for health. You have medical council, you have now strengthening nursing council and mechanism related to, what about the whole infrastructure, whole healthcare, and making the health institution fully functional? You cannot make it functional by looking at one care provider at a time. You have to look at it comprehensively. These are my.
Thank you, Dr. Sanjeev. I think we had some little disturbance in between, but we could make out what you were saying. So here we are going to have the concluding remarks from all our three panelists who are with us as of now. So Dr. Chandrakant Laharia, I begin with you. Dr. Sanjeev, and you have very strongly advocated that the one major thing to celebrate on the health budget or the union budget for health is that we have started our focus on the strengthening of healthcare system or health system strengthening. As Dr. Sanjeev has also highlighted that while we have talked about improving the center's services, we are setting up new centers, setting up new facilities and bodies. We have not talked much about how much is going to be done in terms of getting the right manpower for that, and also not, as Dr. Sanjeev said, on the healthcare system research, strengthening research. What is your kind of concluding remark? How much we have already got, and definitely the desire for getting more is always there for every health enthusiast or public health expert. But how do you see that, keeping in mind that the points raised by other experts also, how should we look at this budget and how much to celebrate on it?
So the key that this budget in times of pandemic definitely prioritize a few things which will help in fighting the pandemic, which is a COVID-19 vaccines. It's a good sign that government has allocated amount which could be sufficient to fund the cost of vaccine by the government for the targeted population, which is a good development, and that will definitely help country to come out of the pandemic. The dialogue or discourse which has been started on linking curative, preventive, and public health components together is also a welcome move. The Pradhan Mantri Ayushman, Pradhan Mantri Atmanirbhar Swasth Bharat Yojana, which would focus upon urban primary healthcare and strengthening infrastructure in rural area, will complement what is ongoing under National Health Mission. Having said that, I would say that while many of us expected that the allocation to core health budget would be much higher, but I'm sure that government would consider to increase funding for different components in the mid-course as per the need. Thank you.
Thank you so much, Dr. Laharia, for highlighting at least, there is enough to celebrate about, and there is enough to be happy about, because health is becoming the priority area. It has taken the center stage, and that is makes that going forward we will be able to achieve what the nation need to achieve in terms of health of the people. Anurag, your concluding remark. You are on mute.
So 3 or 4 points. I think the first one I've made is that health being at the center stage means that it's becoming mainstreamed into the economic and financial and fiscal decision making of the country, and I think that's very important. What the budget does well is the Pradhan Mantri Atmanirbhar Swasth Bharat Yojana focuses on core public health functions. It strengthens preventive care through the 17,000 rural the 17,000 rural health and wellness centers and the 11,000 urban health and wellness centers. And it also improves the surveillance and health preparedness functions, which a lot of public health experts have been saying that they really need to be enhanced. And this is all in addition to the National Health Mission. Then I think the third point is the focus on water and sanitation as a very important determinant of health. Study after study has been saying this. And then the combined focus of both the Jal Jeevan Mission and the Swachh Bharat mission in urban areas, because previously the focus had been on rural areas, but sort of the growing realization that this is where a lot of agglomeration happens, this is where a lot of diseases might originate, has led to them being, has led to the focus for the next 5 years, which should pay rich dividends in terms of health and in sort of terms of human development in general. The vaccines, obviously, I think everyone was expecting it. It's great that the 35,000 crore outlay has been made. And fifth, this I think is important, and more of the details will unfold as we go through the Finance Commission reports. But this earmarking for health, the 13,000 crore in this year, might also have implications for a point that was raised earlier about the absorptive capacities of different states and the utilization of the health budget that is given. So depending on how this grant is structured, that might be one of the things that we should look forward to as we read the Finance Commission report. So those are my points. Thank you
so much, Anurag, for highlighting these important aspects. And again, you have put forward again that Jal Jeevan Mission Urban is also going to be an important aspect related to the health, the overall health outcome which we are talking about. Dr. Sanjeev, your concluding remark.
Thanks. Overall, for all health professionals, it is an occasion to celebrate. But the areas of concern are, we have very good policies in India. We have very good allocations. But the taste of the pudding is the final test. And how do we implement them, and we are able to achieve what we have committed, and then go beyond to address areas like health system, behavioral change aspect, which are emerging as important aspects of improving health of the population. Thank you.
Thank you so much, Dr. Sanjeev. So thank you all our experts. And how, if I, kind of try to conclude what and how we should look at our health budget or the union budget, which from the prism of health outcomes or the impact on health, is that the glass is half full, but at the same time it is under the tap. So it is getting filled. We are, the resolve which the government has shown and the kind of priority it has allocated for the health and well-being of the people, it is unprecedented. And it is echoing the sentiments of the whole nation, and at the same time it is also a very, very rightly move which we have seen, especially at a time when the country is kind of emerging out of this once in a century kind of health crisis. We at ISW Council talk about good air, good food, good water, good medicine, good health care for good health of the people and good health of the nation. And from that point of view also, this budget has definitely taken care of almost every aspect of it, be it the Jal Jeevan Mission Urban, through which the government plan to ensure the quality and the pure drinkable water in the urban areas, or it is about the allocation for tackling the air quality problem, or to promote clean air in our cities, or to voluntary vehicle scrapping policy which the government has brought in, so that we can phase out or we can remove the both commercial and private vehicles at a time when they might become kind of disastrous or damaging for the environment. Also the PPP model with which the government tried to bring the whole public transport system by having more buses, by having more metros. So many such aspects, including the Poshan 2.2 and all other these contributory factors which make or impact the health of the people, are in a way being taken care of, or the government has already started considering them and have started moving towards making the important improvement that it requires. So with this, we would be concluding our session, but I'm sure that we will keep hearing from our various channels of ISW Council. We will try to bring in more opinion and more inputs from the experts, from the doctors, from other medical practitioners, that how do they look at this budget. But definitely this budget is something to celebrate, as it has started many first, and at the same time have put on the priority of has put health on the priority of the nation. So thank you so much, our experts today, Dr. Chandrakant Laharia, Mr. Anurag Kumar, Dr. Sanjeev Kumar, and also Dr. Bobby and Sanjeev Navangal, who joined during this discussion. Thank you so much. Look forward to see you all again. Thank you.
Thank you.